What is a medical technologist? What tests are to be performed by the medical technologists? These professionals analyze body fluids and tissue samples. A medical technologist is a highly skilled health professional who tests and analyzes blood, other body fluids, and tissue samples. Medical technologists are responsible for operating and maintaining the equipment used to analyze specimens and ensuring that tests are completed in a correct and timely manner. Medical technologists' training is more extensive than that of the medical lab technicians with whom they often work. Although medical technologists do not often interact directly with the patients, their work is vital to the appropriate diagnosis, treatment, and care of the patients. Medical lab technologists are also known as clinical laboratory scientists, medical laboratory scientists, and medical laboratory technologists, three names for an MLT person. Concentrations. Medical technologists work in all areas of the lab, including immunology, microbiology, genetics, histology, hematology, chemistry, toxicology, and blood banking. The role of a medical technologist may be determined by the branch of pathology their lab specializes in, but is otherwise only limited by the tools they are provided. Regardless, it is purely diagnostic. Clinical pathology. In clinical pathology, the technologist would conduct and oversee lab tests on body fluids. The tests are performed to identify markers for infectious and non-infectious diseases. Among the specimens a medical technologist will typically analyze are blood, urine, sputum, stool, spinal fluid, pleural fluid, peritoneal fluid, joint fluid, and bone marrow. Anatomical pathology. Anatomical pathology involves the examination of tissues taken from the body during biopsy or any kind of surgery. While some of the diagnostic tests can be performed by a technologist, others require the expertise of the pathologist. The types of examinations a technologist may perform or assist in include cross-examination, examination of tissue with the naked eye, histology, examination of tissue under a microscope, cytopathology, examination of loose cells under a microscope, electron microscopy, cytogenetics, visualization of chromosomes using various techniques. The combined branches of clinical and anatomical pathology are referred to as general pathology. Procedural expertise. Medical technologists are responsible for preparing tissue samples, slides, and cultures for the pathologist to examine, streamlining the diagnostic process and allowing for faster lab results. In larger facilities, technologists will perform more exacting tasks such as molecular, genetic, or genomic testing. They will also step in when confronted with diagnostic challenges, including uncommon or contradictory lab findings. The training that medical technologists undergo provides them the insights needed to know which testing methodologies, tools, and agents are most appropriate for each case. Medical technologists typically work under a pathologist but may be independently tasked to operate a lab itself. Among their duties, medical technologists will oversee the work of lab technicians in addition to managing their own duties. Although the pathologist is ultimately in charge of the lab and its staff, the medical technologist will usually be the one who ensures that the lab operates smoothly, safely, and properly on a day-to-day basis. This includes setting up, calibrating, and sterilizing lab equipment, as well as analyzing and checking the accuracy of lab reports. Most medical technologists operate behind the scenes and do not have direct contact with patients. The health professionals generally tasked with obtaining specimens and phlebotomists and lab assistants. Other specimens are delivered directly to the lab by the doctors and surgeons. Subspecialties. Certain medical technologists will work in a narrow field of practice. For instance, some labs may specialize in genetics or cytopathology only. Others may have specific roles and functions within a hospital or institutional setting. Transfusion medicine. A technologist working in transfusion medicine ensures that there is an adequate and safe supply of blood in a blood bank. Other tasks may include blood typing and screening the blood for infectious diseases such as HIV and viral hepatitis. Forensic pathology. Forensic pathology involves the examination of clinical and anatomical evidence of a sudden unexpected death. While the forensic pathologist would typically be responsible for obtaining the human and non-human specimens, the medical technologist would run many of the tests needed to determine the cause of death. Organ-specific pathology. There are pathology subspecialties focused on specific organs or physiological systems. Working within these subspecialties would usually require additional training to better understand the diseases affecting these systems and the way they are accurately diagnosed.